Okay, great guys. I am so excited to be doing this talk. We get so many people that will go and get a massage, and within an hour, 2 hours, or a day later, their pain kind of comes back. And so that's going to be the big topic that we're going to be talking about today, specifically with the neck and the shoulder, because those really are connected. But first, let's introduce ourselves. My name is Stephanie. And I've been a physical therapist for like 20 years. It's crazy. I don't feel like I'm that old to be out 20 years. Cool. But I just loved it. I loved being a physical therapist because I loved learning about the body. I was always curious. And anytime I couldn't figure someone out, I would just keep on researching until I could figure it out. And ultimately, like over all these years, I just learned that like our body has an amazing ability to heal if we give it the right environment. And it's been fun to like see all the patterns and figure things out and really help people get back to living their life when they thought they couldn't. So we also have Hillary. I'm gonna have Hillary introduce herself. She's one of our new PTs, and she can talk a little bit about herself.
Hi everyone, I'm Hillary. I just started at Empower about 2 months ago, and I love it so much. I get to spend a lot more time with my patients. It's amazing. And I am originally from Boston. I've been treating for about almost 4 years, and I've learned a ton just being out in different environments, treating as a PT. I'm learning a lot from Stephanie as well. I have taken a lot of courses on postural restoration, which implements a lot of breathing techniques, looking at the pelvis and the rib cage and how they interact. And there's also a whole lot other components with the neck and the thoracic spine, as well as the scapula and how they play together with breathing. So I am happy to be here and chat with all of you and help you learn more.
Awesome. So what are we going to talk about today? The biggest things are, why pain pills, medications, injections, and surgeries, and why they don't work. I can tell you, we have been open for 4 years doing this model, and I can count on my hands how many people we've sent to surgery I can't even count on my hands. There's been so many more people that we've been able to save from surgery, even surgery they had scheduled. So like I said before earlier, like our body has an amazing ability to heal if we understand like where things are coming from and how the body works and figuring everything out. We'll also get into MRIs and imaging and why that leads to more unnecessary procedures. And then really, what most of our healthcare providers miss when treating this area. So we'll get into some of those topics, as well as some success stories that we've had at our office. So one of the things that I always say is, where the side of the pain is often not where the source of the pain is located. So we'll get into that a little bit. And then I want you guys to stay tuned to the end, because we have a very special offer that we're going to provide just for the people that are listening to this talk tonight. And then we also have some questions at the end that we'll kind of go over. I know we asked quite a few of you guys, what you guys wanted to learn, and we'll go through a few of those questions as well at the end. So causes of neck pain and shoulder pain. And I'm going to kind of talk through some of this, and then I'm going to have Hillary kind of fill in the gaps of things too as well. But really, I always tell people, if you don't improve the mobility, you cannot get to the stability. And what does that mean? Like, we have to make sure that the shoulder's moving, that the neck's moving, that the thoracic spine's moving. They all work together. And if you don't have that movement where you can't move into there, it doesn't matter about the strengthening and how your body moves, like with the muscles. Like if the joints and everything can't move, then it doesn't matter. And that's where people miss a lot of things. And a lot of times what will also happen is that they'll have like some shoulder pain. They'll have a hard time like moving their shoulder. But their shoulder's not really where the problem's coming from. The problem could be coming from the neck. It could be coming from the thoracic spine. Those are common areas. And sometimes it does come from the shoulder, but you really have to look at the whole picture. And some of the things that create some of these problems are just the repeated movements, the movement habits that we have. We do things like repeatedly over and over again. Like for instance, We sit in front of a computer all day long, and the way we're like looking, and we bring our head forward, and all these things, and how we have rounded shoulders when we're typing, they all affect how we can hurt as if we're doing this day in, day out, day in, day out, and our body's not able to recover from those positions. It creates some of the problems that we're having. And so a big part of what we do, and I know Hillary talks about some of this, was, really looking at the posture and the movement habits. Once we understand where, the issue is really coming from, and improving that mobility, and then we can really get into, some of the tightness that happens between our shoulder blades and other areas of our body, again, are just the symptom of what's going on. So if you just go in and just work on that tissue, that soft tissue, which is kind of what happens when we go and get our massage, then it comes right back again. And it's really common for that to happen, because when that does happen, it means that you're not getting to the source of the problem. Like the tissue, the tightening, the protection that happens is a symptom, and you've got to get to why that's happening. And that's really what we do as physical therapists. Hillary, what other things would you add to this?
Yeah, so just to reiterate, a lot of times we find ourselves getting stuck in these patterns just because of our daily habits and our lifestyle. So we need more of a balance in our life. So if we're in this pattern for, let's say, 75% of the day, which oftentimes tends to be at work, in the office, we've got to do things that kind of bring us out of that pattern and get us moving in other directions and moving well, so that we can kind of get that whole picture and get all the joints moving in the right way. So I always tell patients the next posture is the best posture. Most of the time we're not moving into different positions as much as we should be. And that can cause chronic muscle tightness because you're not moving out of that position. And so really addressing the things that we're doing in our daily life that are contributing to this is a huge part of what we do as well, so that you can start tackling this stuff and figuring it out, how to implement it into your day to decrease symptoms and pain. But definitely getting things moving before trying to get back to strengthening is so important, because if you don't have that range of motion to move through, or you're not in the right position for a muscle to turn on and activate, you're going to compensate, and that's going to pull in probably some bad habits and patterns and things that might cause more pain.
I mean, I know we talk about sitting and work and those kind of things, because that's really what we do in our everyday lives. It happens to everyone, but it comes even into sports. Like you have those, we have baseball players that come in and they have shoulder issues. And it's because they're doing that repetitive throwing again and again and again, and knowing how to combat that constant motion that you're having to do is key. Just like tennis players playing pickleball, all these things, we have people that will complain about them having issues with some of those activities. And again, it's the repeated type motions that happen. And, unfortunately, as we age, we just don't recover quite as fast as we would like. And part of that is that we just don't give our body enough recovery between sessions before we go back to doing those activities again, which creates some of those problems. So let's go into a little bit of the anatomy. So I know we've talked about like how the neck and the ribs and the shoulder blade and the shoulder, and how they all kind of are connected. And you can kind of see like through here, like here's, this is part of our neck. This is where we get into kind of the thoracic spine, which is where the ribs are attached, and our shoulder blades glide across through here. But what tends to happen a lot of times, and why the neck can be an issue with the shoulder, is, all of our muscles come in and attach in through here, all across the shoulder blade. And when that happens and things aren't moving and our ribs get kind of stuck, then our shoulder blade can't move properly through that area. And then we start compensating by using more of our muscles on the outside of the shoulder and in the front of the shoulder, and getting some pain down the side of the shoulder. You get pain between the shoulder blades. You have a hard time like lifting up, because your shoulder blade is supposed to guide, like as we raise our arm, our shoulder blade should be coming in and down, and the ribs should be going in. And they don't if things kind of get stuck. similar to even with the neck. If the neck's not moving very well, you still will have issues into that shoulder area. What other comments would you make here, Hillary?
Yeah, so the shoulder blade gliding on the rib cage is super important. And so for those to be nice and congruent, is going to help the shoulder move efficiently. A lot of times we find that that shoulder blade isn't moving well. And that's kind of a great place to start. So that shoulder blade and the rib cage aren't moving well. So I always take a look at how people are breathing, because you've got the lungs inside of the rib cage, and you can actually help the rib cage move very, very well and get some good posterior expansion through there by using some breathing techniques. So that's kind of how I like to look at the rib cage mobility. Past a manual standpoint, you can use your breathing to help with that.
So we're going to get into a little bit more why medications, injections do not work, and how we actually feel pain. So there's 3 ways that we can feel pain, and I've added 2 more ways that we also can feel pain, but we're going to go for the first 3 right now. So we can feel pain mechanically, we can feel pain thermally, and we can feel pain chemically. And this is going to give us an indication of like why the medications don't work, why the injections don't work. So thermal pain would be like burns and sunburns. And so let's kind of take that off the plate, because that's just a different kind. So then we have mechanical pain, and that's where we're getting into like the movement, like you're not moving correctly, things aren't working well together. It's the mechanics of how the body works. And when those are off and they create pain, you have to address that with a mechanic, like with a mechanic, like a physical therapist is the mechanic essentially of the body. And so that is not something that, you know, when you have mechanical pain, it can be pain that comes and goes. It can be pain that is there all the time. It can be pain, you know, it's usually pain when you move, you can make it worse and you can make it better. It's again, like the muscles and the musculoskeletal system and how they work together. Chemical pain is like you had an ankle sprain and you had chemicals come in and you got that swelling, that achiness type feeling. That's the chemical pain. That's the chemicals that come in. Same thing like when you have an infection, you get the chemicals that come in, you get that like heartbeat, like constant like throbbing type pain. Those are chemicals. So chemicals can treat chemicals. So chemicals meaning drugs can treat chemicals. So if it's something that is super inflamed, can't move, it's throbbing, it's constant type of pain, then you can address that with chemicals, aka drugs, or injections, and that can help if it really is chemical pain. You can have pain that's constant that can be mechanical pain as well. So when it doesn't work, it means that it's mechanical pain. That's what needs to be addressed. And that's really why, like, you know, you can ask yourself several questions to really determine, is the drugs what I really need to be doing, or drugs or injections, or do I need to really go and find someone that's really good that understands how the body works and have them work on me? So, you know, if you can change your position and make your pain better or worse, even if it's constant, then that's mechanical pain. You're moving your body, and that can make your pain better or worse, is mechanical pain. If your pain comes and goes, that again is also mechanical pain. Chemicals don't, like that throbbing doesn't just go away and then come back and then go away and then come back. That's not how it works. So if your pain comes and goes, those are also signs that it is a mechanical issue and a mechanic needs to be addressed. Like a physical therapist that understands the body is who you need to go to get help. And that is why the drugs and the injections don't work. It is the only, you know, thing that doctors can really do before sending you to surgery. Otherwise, they just have to send you out to get some help by physical therapists. So they really don't know. They're just trying to help you as much as possible. But unfortunately, it's not always a help. Like 9 times out of 10, it doesn't help. Even when we've had people go, yeah, it's constant, let's give it a try. Maybe we can kind of get over the hump a little bit faster. It didn't help. But they still got better because they came in and we were able to help them and fix them. Other ways that we can feel pain is you can have autoimmune type pain. And we see stuff like this, not all the time, but definitely frequent enough that we can recognize it. And typically when you see someone with autoimmune pain, their pain is all over the place. Like there's no patterns. Like when you have mechanical pain, you have patterns. But when you have autoimmune type pain, there's no patterns. There's no rhyme or reason. There's no movements that can change it. Then we start asking more questions like, are you having any stomach issues? You'll usually have issues with going to the bathroom or bloating or pain. You'll have some different things that like start thinking, this is more autoimmune. And we definitely have ways of helping you there, as well as getting you to people that can help you. And then there also is emotional pain. So this is, when you have pain, you can have pain that happens most of the time when people come to our office, it's like they've tried everything, nothing's worked. They are completely depressed. They've lost hope. And they literally have almost like PTSD from their injury. Like they're so, they just don't feel like they're going to get out of it. And sometimes we have to get into and tap into that emotion of like when it started and why it happened, so that, and really giving them tools that they are actually in control. Because a lot of times with the emotional pain, you're just not in control. And we're giving you tools on how to start putting you in control so that you realize that you are going to be able to get over this. Now, there can be emotional stuff that happens from like past things that it's not even related to your injury. Maybe it started when your injury happened and there's a lot of other stuff that was going on with your life. We also have people that can help you kind of get over some of those things. But you can tell with emotional pain because they'll be doing better. They will have their, from an orthopedic standpoint, an objective standpoint, they're making improvements, but their pain's still all over the place. They can leave and go on vacation. They feel great. They come back and they start having the pain again. I'm like, those are really good signs that we can start tapping into, like, oh, there's another component here that we need to address. So, Hillary, what else would you add to this?
No, I think it's super important just to realize like where pain can come from, and knowing that there's definitely can be that emotional side to pain is very important. And you might not even realize that you have this emotional side to it. And we're kind of trained to recognize that and look at it and help kind of deal with that, because that will help speed the process up of getting better if you can address that emotional side too.
A big part of our job is really bringing awareness around what the problem really is. That's what we do. We get to the source of it. And so sometimes even bringing awareness around, what you're doing throughout the day or the emotional side of things, you can start understanding like, oh, I see what I'm doing to myself. I see why this is happening. And when we can do that, because we can, we don't have any emotional attachment to what's going on. We just can see it. We can help you. We can help you, resolve this. Bringing awareness around it is huge. It's one of the biggest things that we can do for you so that you really understand why. Like, why is this happening? We have to get to that, because if we don't, you just go back to the same patterns, the same thought processes, the same things. And that's where, and you'll still you won't fully resolve. And our whole goal is to get you back to living your life the way you want to live your life. So another frustrating thing is why surgeries lead to frustrations. I can't tell you how many people had, and we're going to hear a story here in not too long ago, like in this presentation, but I can't tell you how many people that either had a rotator cuff tear or were about to have a rotator cuff surgery, or had the surgery or about to have the surgery, that's not where their pain was coming from. When I start asking questions like, what did you do? Well, I'm not really sure. It's just wear and tear. I, start thinking, there's probably something else that we need to look at, because that's probably not where your problem is. If you told me that you fell, you grabbed on something and like your shoulder felt like it almost like ripped off, like that's different. Like you could have definitely torn your rotator cuff doing something like that. But when you aren't really sure what it is, then you really, how you injured yourself, that's a clue right there that there's probably something else that you can do and where you can avoid the surgery. So if you don't really understand like where the source is coming from, you could be doing surgery on the wrong body part. We've had patients that had like 3-level fusion in their neck, and they come in and they're like, I don't understand. Like, I'm not any better. I had 3-level fusion and my shoulder still hurts. And I'm like, probably wasn't a neck issue. Actually really was probably a shoulder issue. I mean, we weren't telling them that, but that's exactly what I'm thinking. You know, I'm just like, well, we're going to get you figured out. We're going to help you get back to living your best life. And, you know, we'll figure this out. But at the end, he was like, I should have never had this surgery. And that's really what's frustrating. When I see that with clients, is that they had surgery or something done that they didn't need to have. Another surgery that we see all the time that doctors will do is they'll do a thing called subacromial decompression, where they're just opening up the space in your shoulder because your shoulder hurts. That's usually not a surgery that really needs to happen. That's just a surgery that they don't really know. You're having pain in your shoulder, but really, I can't tell you how many people that had surgeries like that it was really something that was coming in their neck that was really giving them the problem, and not anything in their shoulder. So yeah, it's frustrating. We see stuff like this all the time. What else would you add, Hillary?
No, yeah, I just have to agree. Like subacromial debridement in there, I've seen that before, and it's just like the patients, they're just like, I don't know, it just didn't do anything. What's going on? And then you have to rehab that and get that better, and then also figure out, you know, where was the pain actually coming from. So it just honestly makes it a longer process sometimes.
Even if you have neck issues, or you're told that you have degenerative changes that are happening in your neck, or herniated discs, and the herniated disc is hitting a nerve, these are totally things that we see all the time, and we can help people get resolution without having surgery. So even when you get these scary diagnoses, and I think we'll be talking about imaging here in a second, but when we get these scary diagnoses, it doesn't mean that that's where the problem's coming from. Or if there is the problem where we do have something pinching a nerve, we see stuff like this all the time, and we can help people get full resolution back, and them understanding what they did that created their problem, so they can get back to understanding what they can do if they start noticing their symptoms again. So just because you get these diagnoses or you do these imaging does not mean that that's what's going on, or that you can't get resolution without surgery. So yeah, leads us right into imaging and why that leads to more procedures. So if you look at imaging, if you look at the research on imaging, if you took 100 people that have no pain whatsoever, no pain, no problems, fully functional, you know, can do everything, 60 to 80% of them are going to show something. Like, they literally have research showing 60% of people will have rotator cuff tears in their shoulder, but they don't have any pain or problems, and can do everything. Actually, baseball players, 90% of the baseball players have rotator cuff tears, but they're pitching at these like crazy speeds. So just because you have something that shows something doesn't mean that that's what's going on. And just the same way with like arthritis, herniated disc, facet issues, all these things that you can see on imaging. Yes, you may have a herniated disc, and it may be pinching a nerve, and it may be, you know, your C6 nerve. Like, we can figure that stuff out. We can almost tell you exactly what level is at, especially if you have symptoms into the arm. But it doesn't mean that we can't help you and that we can't get you back to really functioning. I mean, a lot of times what happens is because doctors have no time with you, all they do is send you off to get imaging and then say, okay, this is what it is. And so we need to go and have surgery on it, or let's do an injection and see if that helps. Oh, that didn't help. Okay, now you need to have surgery. Or they'll give you a few like blanketed exercises and it didn't work. And then they say like, okay, let's go and have surgery. So that's typically what happens in our medical system. And it's really, really sad. Really sad. Anything else you want to add?
Yeah, I mean, so imaging is going to tell you every little thing that, well, sometimes it misses things, but it's going to tell you everything that's going on in your back or your neck. And a lot of times that's not the cause of the pain. So a lot of times it just makes people a little bit more fearful of movement, or like, well, I saw this, and it can be kind of upsetting to see your imaging results. And then sometimes that will drive some emotional components. So a lot of times it's not necessary to even have the imaging, and we'll be able to tell you like, hey, listen, we've tried this and this and this. You know, maybe it is necessary to go in to get that in an imaging, but it's a lot of times not that first step at all for what you need to be doing.
Yeah, you could spend your money
Yeah.
figuring out, like giving you tools to understand what you're doing and how like why it's happening, versus getting an MRI. I don't base anything off the MRI. It
Mhm.
doesn't guide me in my evaluation at all. I look at it, I'm like, okay, this is great. Yeah, okay, well, we'll see what it is. So it doesn't really help me at all. And another thing that I usually tell people is, you know, as we age, you know, it's one of the aging processes that happens is we tend to get like wrinkles on our face. Like it's just a part of the aging process. That's just what happens as we get older. Well, same thing with like imaging. As we get older, imaging picks up more and more things because our body has aged. So like degenerative changes are just like having wrinkles on our face, like even wear and tear from a rotator cuff or a meniscal tear or whatever. These are just wear and tear things that happen as we get older, but it doesn't mean that that's where the problem is coming from. So we really, when I tell people if an imaging, if they need to have imaging, I usually want to ask them like, how is it going to change your treatment? Because it's not going to change what I do. So ask your doctor how it's going to change his, like what his philosophy is. If it's, I know we need to have surgery and I got to figure out what kind of surgery, I could see why you would have imaging there, because you're determining if the surgery is what type of surgery you're going to have, you know, for something that was like an injury that we know, you know, you tore your ACL and we want to know what else it was so we can just make sure, you know, what else we're going to have to do in that procedure. But it's not something that that we need, and it's not something that guides us in our treatment at all. So some of the big things that happens like on like what other healthcare's misses when treating this area. And I'd say the biggest thing is that in our healthcare system overall, we just don't have enough time. Like we do at our office because we do it differently. We make sure we can sit down and talk to you for 30 minutes, just to see if we can actually even help you. And there's no charge for that. And, you know, when we do evaluations, it's an hour-long evaluation one-on-one. When we do treatments, it's an hour-long treatment one-on-one. So we can really start asking questions and really get a good understanding of how your body moves. But that's not the case with a lot of other healthcare providers. And so they just don't have time. And so when they don't have time, they do a lot of these shortcuts that we see. So a big one is they don't get into lifestyle changes and posture habits. Why did this happen in the first place? What are you doing that created some of your problems? Because we've got to address that. And if we don't, it's kind of like when people go and they have heart disease and they did bypass surgery because of a clogged artery. They just bypass the bad part. But then the doctors will say like, well, yeah, just live your life. We helped you, like no big deal. Like, but why did that artery get clogged in the first place? If you go back to your same habits that clogs that artery, it's going to get clogged again. And we've got to give you tools to teach you how to not have that happen again. Same thing with the body. We've got to give you tools and teach you what you need to do to combat what you want to do in life, so that you know, okay, I know if I'm doing these, I need to make sure that my posture looks like this, or I need to do these stretches after so that I combat some of the things that I'm doing throughout the day. Like we've got to have those tools for you. Another thing is a lot of times people only look at the side of the pain. They literally are like, oh, it's my shoulder. Let's just do some rotator cuffs, exercises. Let's do some rows. And that's all that they'll do. They'll just go to the side of the pain. They'll rub on where the side of the pain is, but often it's not where the source of the problem is. So that's a big problem. And they only look at the injury one way. So for example, massage, they only look at your soft tissue. Sometimes PTs, they only look at the strengthening component of it. They don't look at the whole thing. Injections only look at the chemical side of things, if that's even like the problem to begin with. So they only look at the injury one way, and that's a problem. You've got to look at the big picture. You've got to look at everything and understand everything. This also, you're made to feel like you're on this hamster wheel, like no one's putting the whole thing together for you. They're just looking at it like pieces. I go to the shoulder doctor, then I go to the neck doctor, and no one's talking. And there's one saying one thing and the other one saying the other thing. And so really it's looking at putting everything together. And that's including emotional, that's including, autoimmune, we look at everything so that we can really help you get back to doing everything that you want to be able to do.
Yeah. We see people who come in who are seeing a chiropractor, an acupuncturist, been to massage therapist, they've been to PT before, and then, they're kind of just like, well, I don't know what else to do. But if you have somebody who can take the time to address all the components that can be contributing to the pain, then the outcomes can be they're a lot more efficient and a lot faster. It's just really important to look at all of what could be contributing.
Yeah, exactly right. So here's one of a patient who literally had rotator cuff surgery scheduled, and she happened to call our office. So I'm just going to share this video with you guys so you can kind of hear her story. Okay, so we have Stacy. She's one of our past patients, and I really wanted her to kind of share her story, because if anyone's ever followed me with anything that I say, I always tell people where the side of the pain is often not where the source of the problem is. So Stacy, tell us a little bit about what happened when you started hurting and everything you did.
So about 1.5 years ago, I realized I could not raise my arm above my shoulder, so I couldn't do this. And I wasn't really quite sure what was causing it. I mean, it was probably because I sit at a desk all day, doing CAD work and, sitting there mousing all day long. And then I noticed, I kind of remember getting a kink in my neck at one point, and then it seemed like it got worse following that. So I think it was just a combination of things, and over maybe several months or even a year, it just sort of got worse and worse. So I decided I would go see a doctor. So I went to an orthopedic surgeon, and he prescribed a physical therapist, and I went for a brief time, but didn't seem to help. So I went back to him. He gave me a cortisone shot, I think, and that didn't work either. And so then I continued with that therapy. That didn't really do much. And eventually he suggested that I have surgery because I had a tear. I had a tear in my shoulder.
Supposedly. Yeah, I think you got an MRI and it showed a tear, and then around that same time, probably a month before that surgery, we started talking. And I was like, what? What did you do? Did you fall? Did you do anything? And you're like, no, it just really came on. And I was like, okay, that doesn't really make sense. And I started asking more questions. And
so that made me start thinking, well, maybe I shouldn't do that, because that's very extreme. And I know my mother-in-law had surgery on her shoulder, and she was miserable for months and had to sleep sitting up. And so that just sounded awful. So thankfully I happened to talk to you, and you said, no, well, why don't you just come in and see me? So I came in to see you, and so I mean, the first thing you had me do, from what I remember, it's been a while now, you laid me down on like one of those rollers, and I just kind of laid there like, back.
Yeah.
And I'm like, wow, that's really tight. And so I continued to do that, and that seemed to kind of loosen things up, immediately. So,
when you were talking about how you didn't really know what you did, I'm like, well, that's just really odd. And then I started asking, like, are you noticing anything like in your neck, in between your shoulders? You're like, well, actually, it kind of started there. And I'm like, oh my gosh, no, you have got to come in. And then that's when you came in. And a lot of people don't even think to look at the neck or even the thoracic spine for some of these things. And I know I pretty much said, like, did they give you like rotator cuff and rows? You're like, yeah, that's exactly what they gave me. I'm like, yeah, that's why it didn't work.
Right. It probably just irritated it more.
Well, it probably did, because again, it's like a lot of times you go to places and all they want to do is like, oh, it's rotator cuff. Okay, so they don't investigate, they don't ask questions, they just go, okay, it's rotator cuff. This is the cookie cutter thing that we need to do for the rotator cuff, and that's what happens. And so that's when I was like, no. And there's so many, our shoulder blade has to like glide, through the ribs. Like the ribs have to be able to move, and if they don't, then you don't get that shoulder blade connection very good, and it can affect you even lifting your shoulder. And I know that like, we didn't even touch your shoulder. I don't even think we gave you shoulder exercises. And it like completely resolved when we did all the back stuff. And
Right.
I can tell you, like what you're telling before, oh my gosh, rotator cuff surgery is not something you want to do. It is probably one of the worst surgeries because it's a 6-month ordeal. I mean, you're literally, you would have had to have bought like a recliner because you can't sleep in bed because it hurts so much and you don't get sleep and it's so hard to function. So yeah, I mean, it, you know, you went from like potentially a 6-month issue to a 6-week issue.
Right. And then I just continue to do those exercises and everything seems to be fine. I mean, I still have a little bit of kind of pain, a little achy pain, but it's nothing like it was where I couldn't raise my arm, you know. And when I have a little bit of pain, it's most of the time it's because I've been sitting at my desk all day.
Yes. And then you just go back to doing the stretches and it goes away like that.
Right.
And that's ultimately, I mean, that's the reason why most people get their pains. Honestly, it's the sitting. Like sitting is like worse than like smoking and drinking and all that kind of stuff. Like it is so bad for us, and that's what we do all the time. And that's why it'll kind of slowly kind of come back. But if you go into the exercises, it stays away, and you know exactly what to do.
Yeah. So yeah, it's so much better, and I'm just grateful I did not go through with the surgery, and so what you recommended definitely worked. And
well, I'm so glad that you're able to share your story, because I know there's so many people out there that potentially are going down that same path. And there's times, I mean, we're not totally against surgery. I mean, there's times when surgery is needed, and we've told people like, I agree, I think surgery is needed, but I would say, you know, more times than not, it's not needed. Like there's so many, our body has an amazing ability to heal if we know what to do and where the source is coming from. And that's kind of what we do. So thank you so much.
You're welcome.
So what can we take from this is that most injuries do not require surgery or medications. We have saved people from having neck and shoulder surgery all the time. There was another patient that we saw that actually had the rotator cuff surgery. And I spoke to her before the surgery. I didn't know everything else that she had done before the surgery, but I spoke to her and I was begging her to come in, and she ended up having the surgery. And literally she was having, you know, after the surgery, she got worse, and she would have to stretch an hour before getting ready for work so that she could actually semi-function. She literally was like functioning as much as possible just to be able to get to work and come home, and was completely exhausted. And I finally said, like, when you get to your low point, just call us and we'll figure it out, because they're missing something. And so she did. 2 weeks later, she called us, and she had like stem cell in her shoulder. She had injections in her shoulder. She did PT, she did chiropractor, she did massage, finally did rotator cuff repair. That made her worse, and did therapy 4 days a week for like 4 months. It was horrible. And when she got to me, I said, well, there's like 1 or 2 things that someone's missing. So let's just go and we're going to rule out the neck first. And she didn't have very many neck issues. Her neck wasn't that stiff at all. And she, you know, had a little bit of limitation, but it was nothing major enough that where she could barely lift her arm, and she was having so much pain. But I'm like, we're just going to roll it out. So we went and took her through a few movements. And I mean, like that first visit, she was 70% better. It was amazing. I actually, you know, had so much less pain just off the one visit. Now it still took 8 weeks for us to get her back, but she'd been dealing with this for like years. It was amazing, the transformation in that short period of time. But yeah, it was like someone that shouldn't have had the surgery. No one really put all the pieces together for her. So again, most of the people don't get to the source of the problem, or why is this happening? What are you doing throughout the day that's creating some of these problems? You know, MRIs, x-rays don't help in guiding treatment or resolving neck or shoulder pain. They just don't. Like it's an expensive selfie. There's other ways that you could spend your money much better. And then seeing a specialist to really help figure out where the source is coming from. Like seeing someone that understands the body, like everyone in my office, every physical therapist in my office is amazing and fantastic. and they really can figure out what's going on and why this is happening. Where when you go to other places, they don't. And we commonly hear that they've tried everything. Even people refer us people, and it'll take them forever to come in because it's like, well, I've tried physical therapy. I've tried everything. Nothing has worked. I mean, they've literally lost hope. And we've been able to get some pretty amazing results with our clients. So really there is hope. That's what we want to give you. There's hope that you can get back to living your life, that you can get back to what you love doing. What other things else would you share, Hillary?
I think it's challenging, like you're going in to see a doctor, see like an orthopedic specialist, and they're, recommend, they do the imaging, they recommend that you have surgery. And a lot of times, like, people just don't even ask the right questions or know what to ask. So they're going into surgery thinking, great, like this is going to solve everything. And so it's just really sad, like, because, if they just maybe tried a PT that could spend the time to look at everything, and they would just not have to go through with a surgery and rehabbing from it, and then at the end being like, oh man, that didn't work. Like, that's a big mistake to make, so it's why we love our job, is because we get to help people not to go through all of that, and really get back to what they want to do and love to do without going through these surgeries and not even knowing kind of like what they were getting into sometimes. So
yeah, and I think if you watching this, if you even go and see what our reviews say, like we have people that share their story, and a lot of people that share their story and with our Google reviews, and it's because we've just been able to impact their lives. And we tell them, like, share your story, like you're going to be able to help someone else know that this is a place that we can help them. And even if we get to the point where we can't, we have other places that we can send people. It's just rare that we can't get people back or to understanding like what their next steps are, where they need to go, those kind of things. So we have some special offers for you guys. One of them is you can come in and talk to us for free. And really this is so that you can sit down and we can help you make a better decision about your health, whether that's coming in to see us or just getting confirmation of what you want to do. But we can really sit down and just navigate that a little bit better. And we do have they do fill up. You will, at the end of this talk, you'll have an email that goes out with these offers so that you can just click on it, sign up for it, and save your spot. But we do have limited spots because we are a busy office, but we have opened up a few more spots over the next couple of weeks. So just make sure that if that's something that you want to do, then make sure that you click on that so you can save your spot. We also have, if you want to come in and you said like, yes, this is the place that I want to come in on, we will give you $100 off our full evaluation. And if you do that in the next 15 days. So $100 off your full evaluation. If you're like, yes, this is a place I think they can help me, then we'll give you that off in the next 15 days. Another client success story is we had another person who was suffering with shoulder pain. And he was having difficulty playing baseball with his son. Like that's what he loved to do. And he couldn't throw the ball. It was really affecting him by not being able to do some of these things. And we went and we looked at his neck and like rolled it out. I'm like, okay, this must be a shoulder issue. I mean, he had pretty much full range of motion, just some pain at the end. We started addressing some of those issues and ended up going like, you know what, let's go back. I started asking more questions and we went back into that thoracic spine, and sure enough, that's what it was. As soon as we just did a few mobilizations, showed him a few things, then all of a sudden his shoulder started opening up, and then we were able to start working on the strengthening aspect to get him back to playing baseball with his son again. But it's just another example of, you know, when you can spend time with people, then you can really go in and start figuring out where things are. When you come in, every time you come in, it's an evaluation. We're evaluating where you were from before and how we can get you to move to the next phase of where we want you to be. And every visit is like that. And every visit we send you home with like, this is what your next phase is. This is what you need to work on over the next 4, 5, 6 days. so that we can have you slowly progress to getting back to all the things that you want to do. And again, just going back through the several options is come in, have us talk to one of us for a free discovery visit, and we can really sit down for 30 minutes. That's free. To really help you understand like what's going on better and like why some things haven't worked and what we look at. And then again, if you decide you want to come in for that full evaluation, we are going to give you $100 off if you come in the next 15 days. So, which is a really, really sweet deal. So I know we had a few questions. And one of the questions was, if I have stiffness in my neck, does it create headaches? And that is a big old yes. So, and I'd even go into the thoracic spine. I find people have thoracic spine issues that also will create headaches, like especially if people are at night when they lie down and they start getting some of their migraines. I look into that area. But we look at the whole thing. It's usually a combination of, there's a lot of sections of the neck and they all move a little bit differently. And we have to address each part of it to see where things are coming from. It may be coming from one source, but it may be 3 or 4 different things that we have to look at to get everything moving. But we see people with headaches all the time, and we can tell when they're mechanical. You can have also emotional type of things that happen with headaches. There can be food triggers. There's so many things that can create headaches. But you know, a lot of times we can ask questions to start narrowing some of those things down. What other things would you add, Hillary, for the headache?
Yeah, so headaches can be confusing because they can come from a lot of different sources. It can, be some of the emotional stress, but we can rule a lot of them out and tell if it's coming from, if it is a cervicogenic headache coming from, some of the mobility in the upper cervical spine, thoracic spine, and then also some of the muscles that attach to those areas, if those are reacting to the joint not moving, and really figure out where the source of it's coming from. But yes, it definitely can be coming from that cervical or thoracic spine.
Awesome. Well, that was our main question that we had, and we're going to stop the recording. And if anyone else has any questions, then we'll get with you guys on that. And
awesome.
let me